for $750 million from the U.S. House, and the U.S. House has absolutely refused to give it to them. So they may never get it built, and if they can't get it built, they can't impose it on us. Therefore, they are now trying to get states to join together with them in federally facilitated exchanges. The federal government would run everything behind the scenes. Each state would have a website with a state name, so it doesn't look like a federal takeover. And then the states would pay the federal government a fee for operating it. Well, there's only one answer to all these iterations of federal control. The states must just say no. Unswervingly, unendingly, no. State legislators have also been told that they have to build their own exchange so that the state will have control over it. They've been told that if they don't, the federal government is going to impose this one-size-fits-all federal exchange. But I hope, as you can see, these are all lies. Every exchange is under federal control, and the so-called federal exchange doesn't have any money to be built. State control will only happen by refusing to build a state-run exchange and refusing to join in a federally facilitated exchange. There are so many reasons to oppose the health insurance exchange. There is a list of 10 reasons that you have been handed out, but there are more. And I'm just going to share 5, and some of them are not even on your list. So number 1, and in no numerical order of importance, just 5. Number 1, the state operating cost of an exchange is between $10 million and $100 million per year. This is one reason the Obama administration wants states to build them. They don't have the money, and they want it not to look like a federal takeover. They want you to build and fund the federal takeover yourself. Number 2, the exchange puts every business at financial risk. If even one employee of a company goes and buys health insurance on an exchange and gets a subsidy, that employer can be fined up to $3,000 for every employee in the company. No exchange, no fine. Number 3, 98% of Obamacare spending goes directly into the pockets of managed care companies through the expansion of Medicaid and the payment of premium subsidies in the exchange. Without the exchange, health plans can't pocket nearly $1 trillion of taxpayer money. Number 4, as part of something called risk adjustment, the law requires states to calculate individual risk scores on every person in the state through your medical records. So the federal government can transfer money to the plans that have the riskiest patients. Expect health plans to do everything possible to make you look as sick and risky as you possibly can, because then they will get even more of the taxpayer money. And the 5th reason to oppose the exchange, in addition to all the other ones, is if you buy insurance on the exchange and you receive a subsidy because of your estimated annual income before the year even begins, but at the end of the year, your income is higher. The government can come back and require you to pay back part or all of the subsidy, even though the subsidy went directly to the health plan. And this is called a clawback. So bottom line, the exchange is the heart, guts, and soul of Obamacare, and it must be stopped, prohibited, and banned. Even better, it can be stopped. At least 28 states have said no to the exchange until after the election. But I'm here to ask you to tell your state legislatures that they must say no before, after, during, and every other possibility of the election, because this is the only way that they will stop Obamacare and socialized medicine from being implemented in this country. So they must write and enact laws prohibiting any government exchange. They must also refuse to expand Medicaid or to allow any Medicaid or to give any Medicaid data to a federal exchange, because then the federal exchange cannot operate within your state. If states don't cooperate, Obamacare is virtually dead. So I'm asking you to help your states not cooperate. States have the power to stop Obamacare, and after all, what are the feds going to do? Are they going to tromp into your state, send the army into your state, and jail your legislators for not making this happen? They can't, they won't, it won't happen. It's important for your legislators to just stand up. I'm asking you to do whatever you can to stop the exchange. You can ask me to come to your state. You can call us for advice. You can go on our specific website for this issue, nixthehicks.org. HICS is Health Insurance Exchange. That's the terminology in the federal government. So nixthehicks.org would be a place to find all sorts of information about this issue. Our life, our liberty, and our future as a free nation hangs in the balance. Will the government get control of our health care, and with it, the power to decide whether we live or die? And remember, we're talking about a massive database and tracking system that I really believe will be used for many more things than to impose national health care. The exchange is vulnerable. There are so many reasons to oppose it. We can stop Obamacare if states just say no. So please do what you can to win this critical battle for this country and for freedom. Thank you.
We'll take a couple of questions if you line up. Now, are you saying that we can kill Obamacare if the state legislatures just do nothing and do not enact the exchanges?
Yes, Phyllis. I mean, there's 2,700 pages of Obamacare, but much of it relies upon the health insurance exchange being the main mechanism to push it forward, to do all the tracking, to decide what kind of services are available, all of that. So there are pieces of the law that not having an exchange would probably go forward, but they cannot create the national system. They cannot do the federal takeover without this main infrastructure.
Well, how about the order that insurance companies have to provide A, B, C, and D?
That they have to provide the essential health benefits. Would that be what you're talking about, perhaps? That could go forward. I mean, that can go forward, but it's going to be hard for them to actually have a tracking system. It's within the exchanges is where that is supposed to happen. That the essential health benefits are all that the exchanges, that the health plans in the exchanges can offer and must offer. So that's where the real control comes, is within the exchanges.
All right, I see we have a lot of people lining up. Please make your questions real short.
Twyla, it's good to see you again. Is there any model legislation that anybody has produced? Have you all or somebody else produced model legislation that we can perhaps get to our state legislators?
Yes, we haven't got model legislation on our website, but I was thinking of it in the plane today, that we should put the bill that we had for legislators in Minnesota, and it essentially prohibits the implementation of any kind of exchange, any kind of federally facilitated exchange, and we should just put that on our website. So we will do that by next week.
But the legislature could just do nothing.
But the legislature could just do nothing. Although the federal law says that they can have a federally facilitated exchange, and so it is better for the legislature to say, we are not going to take any kind of exchange.
Thank you. The Congress put out a letter to all the Republican governors that said, please do not enact these exchanges because it will make it more difficult for us to unravel them. So those of us in states like Texas that have staunch Republican governors have a little bit of a head start on this. But I heard something yesterday, I wonder if you have heard anything about. This was a proposal that because more money is spent in the last year of life, medical care, that in order to try to keep from being gouged, is the term they use, during the last year of life, that there should be a set standard of how much money could be spent on a patient during the last year of life, and if a hospital or doctor or whoever spends more than that, that they will be fined and taxed upon that extra revenue, an additional tax. Have you heard anything similar to that at all, Twyla?
I have not heard that specifically, but I'm not surprised. If we even look at what has happened recently in Massachusetts, you remember Massachusetts had the very first exchange. And Massachusetts now changed their law to say that any doctor, any provider, any health plan, any hospital that goes above the global spending limit can be fined up to $500,000. So that's moving in the same direction. And I guess I would just like to say that when it comes to this whole idea of telling us what happens in the end of life, Part of it is because we have a single payer system in this country, and it's called Medicare. And Medicare is the elephant in the room that is controlling all of healthcare, and we have to figure out what to do about Medicare in order to move out of this situation. We have Obamacare because of Medicare. There isn't any politician that wanted to deal with the $38 trillion unfunded liability that's coming that will deny all sorts of people access to care.
Thank you.
We are from California, and as you know, that's a very strange state. I'm sure we could never get such a thing to be passed. But if a state were to pass this model legislation to stop it, could a county on their own still go through and ask for it? Because that's what they're trying to do with the Common Core Education Program districts. Even if their state has said no, districts can go ahead on their own and apply for Race to the Top. I wondered if they've thought of such a thing.
I have not heard of anyone thinking at a county level. I mean, the sheer cost of an exchange, $10 to $100 million a year, is something that I don't believe any county could be able to do. And states are having states are having trouble even thinking of that kind of an expense.
I'm from one of the lucky states that has the exchange. I would like your strategic advice for what we are to do about this. If you've worked with other states that already have these exchanges, we just happen to be so very lucky. We are from Mike Leavitt's state. And the elected officials that I have talked with behind the scenes, who are our most trusted conservatives, have each said, Mike Leavitt is the problem. He's controlling our governor and even our conservatives. What do you offer as advice?
Well, Utah and Massachusetts are the two states that have exchanges, and Utah has what's called a shop exchange, which is for small businesses, and it's voluntary, but it was created by the government. And neither the Massachusetts or the Utah exchange actually comply with the Obamacare exchange. As a matter of fact, the Massachusetts exchange is only 59% of the way through the 109 milestones of an Obamacare exchange. So when I think about strategic for you, it is still about convincing your legislators to not let that exchange be moved into an Obamacare exchange, to not comply with any of those milestones, to not comply with the law, et cetera. That's just where it has to be, is to not move that way. The Utah exchange is not compliant today. So it can't just do it all by itself yet.
I'd like to ask you, can you give me definite numbers regarding an individual or a family income where people don't have to buy this insurance? Do you have any numbers there?
Well, if you mean on the exchange versus just buying insurance in general, is that what you're talking about? Which one?
Well, we're fined this $2,000 each
I see.
if you don't buy it.
Oh, I got
Okay,
it.
some people that make a very low income, obviously, are not going to be able to buy it. Can you tell me what the individual income would be and what the family income would be?
So it's all at the federal poverty guideline limits, which it's 137% of federal poverty guidelines for that. All of them can be in Medicaid. So anyone can be in Medicaid that is below that limit. And I'm trying to think, it's like $9,000 and something for an individual. Above that, all the way to 400% of federal poverty guidelines, which is a family of four that makes $88,000 a year, and it will eventually be over $100,000 a year, can get a subsidy from the government to help them to buy their health insurance. If you make one dime over 100% of federal poverty guidelines, you have to pay the whole freight. And so heaven forbid all the young people who are going to be facing, as I said, sticker shock, and they won't have any subsidies, and they will be paying for all the elderly in their policy, even though they're 25 or 30 and healthy as a horse.
But the bottom line is this $88,000 for a family of four? If
Yes.
you make
That's up to the 400% level. What you're talking about, who doesn't have to buy at all?
Yeah, who isn't going to be forced to buy it and they won't get fined $2,000?
Okay, there are 8 exemptions, and one of them is a hardship exemption, and you have to apply to the Secretary of Health and Human Services for her to declare that you have a hardship. So that's one of them. If you have a health sharing organization, if you're part of a health sharing organization like Medishare or Samaritan Ministries, that's another one of them. If you're, this is an interesting one, if you're an American Indian, you are required to purchase health insurance, but you are exempt from the fine if you don't.
Could you just have a little bit of that in your background, like maybe one grandfather that was Native American?
You're really 1/16.
I have some particular people in mind, and that's why I'm asking these questions.
Yes. Well, so there are eight exemptions, and they're not all coming to my mind at the moment, but there are 8 of them, and those are the only ones that aren't required to buy health insurance.
But you don't have to be 100% Native American, is that right?
Now, there's nothing in the law that says 100% or anything. Just American Indian.
Thank you for your excellent presentation. My question is political.
Okay.
Where is Governor Mitt Romney on this? Because we all know how skittish politicians are, governors, state legislators, members of Congress. It's a lot harder to get them to do something if they perceive themselves as being against the leader of the party, and he is the leader of the party now. He has said pre-existing conditions, yeah, I'll keep that, and he says I'm going to repeal Obamacare. Is he behind what you're trying to do? And have you talked to his campaign? If not, where do we stand?
Well, I'm going to just mention this, that I want to say something about pre-existing conditions, but I'm going to answer your piece about the exchange. He has said that he is going to repeal the law, but he